over the past several years, at least in the United States, the practice, how we approach patients in first line with advanced Hodgkin lymphoma has been changing. Based on the results of the echelon-1 trial, I think most institutions adopted the use of the Brentuximab AVD over the traditional ABVD approach. And what we were interested is in how the different centers and different groups manage one of the major toxicities of this regimen, which is neuropathy. And so we looked at several centers in the United States and are presenting the data on the sort of retrospective review on the incidence of the neuropathy, how people manage it, and also on the outcomes. We're interested if the outcomes are similar in real world as opposed to the clinical trial. As you realize, the clinical trials are somewhat selected population. Also, the management of the clinical trial patients is driven by protocol. So, it's fairly kind of by the book as opposed to in the real world where people do different things. And so, you can see the results of our abstract in the publication, but I think the main points were that the neuropathy incidence was similar or a little bit higher compared to the echelon trial. But again, remember that some of the patients in the real world would not make it to the echelon-1 in terms of the inclusion-exclusion criteria. So they might have had a little bit of neuropathy to begin with, or they would not fit some of the criteria. But the important finding was that even with more dose reductions and more sort of discontinuation of Brentuximab in the real world as compared to the echelon-1, the outcomes remained really great. So I think that's important that in terms of, people may be having lower threshold to stop Brentuximab in terms of the neuropathy management, the outcomes with this regimen were excellent. The other sort of important point, I think, from that analysis of over 150 patients was that the different centers, they had different strategies. So some people would modify the Brentuximab, some people would stop the Brentuximab, but actually some centers also stop or modify the Vinblastine, which is the other agent in the cocktail that causes neuropathy. And again, that may be one of the strategies that would be interesting to explore.